Good morning, everybody. It's Dr. Adana. This morning, I'm actually here to talk to you a little bit about prenatal chiropractic care. So, as you know, our practice not only specializes in pediatric care, but we also take care of a lot of pregnant moms along with the families we take care of. So, a lot of times we get the question of, well, why do pregnant moms need to be adjusted to begin with? Is it safe for a brand new baby? Is it safe for a growing belly? Is there a certain specific time that's better to be adjusted and not adjusted later on, earlier on? A ton of questions, of course, are asked, and I'm here to answer a lot of them as quickly as I can. So prenatal chiropractic care is completely safe and effective throughout your entire pregnancy. Ideally, I would actually like to see a mom pre-conception so that I can make sure her body is functioning at its absolute optimum, that everything internally is working like it should, so that when we do actually conceive, things are already working at such a better place and the body is already in such a better place. Of course, if that's not the case, that's all right. We have moms that see us when they're a couple months along, a couple weeks along, or 5-6 months along for whatever different reasons. At any point, it's going to greatly benefit your growing baby, your growing body, and just the entire pregnancy process. Now, this time around when I'm actually speaking to you, this topic is a little bit near and dear to me because I'm going through the same thing right now. Tomorrow I will be 21 weeks along and I've had an incredible pregnancy so far. I had no morning sickness, tiny bouts of nausea here and there. I was very tired, I will tell you that. The first trimester was a little tough because I was very, very tired. But I've kind of gotten over that hump. My energy is great and my body feels really, really good. Now, as a chiropractor, I'm constantly standing, which is a little bit better than if you're sitting at a desk because that's a ton of pressure on that lower back area. And why that lower back area is so crucial and so important during this time is because neurologically, that's where the nerves going to baby's home come from. So let's pull out our spine and see. So we've got our awesome pelvis, our sacrum, our lower back area. Well, the nerves in this area of the spine, these are the nerves that not only go to your lower back muscles, down into your legs and feet, but they're going up front to all your reproductive organs. They're going to your uterus. That's where baby's home is. You know, do I want these nerves to be working at their best throughout this crucial time? Of course I do. And even more so, what else do we look at? We want to take a look at this balance. So we're looking at that lumbar area, the sacral area, the pelvic area, and we want to make sure that we have beautiful balance throughout that entire system because the more balance we have here, the better it's going to free and open everything up in here for baby. At the same time that we balance out that sacral area, we also check and see if there's any issues or any tightness with those round ligaments. So our round ligaments are going to stretch and you're going to start to feel them a little bit more as that belly's getting bigger. But any tension on those is not only going to be painful and uncomfortable, but it might actually not allow baby to be in the most optimal position. So remember, when we balance out this area and balance out those round ligaments, we are absolutely doing our best to avoid any in utero constraint. Anything that's not going to have baby head down when they need to, anything that's going to help baby be in complete perfect alignment. Because look, I don't want the baby completely head down, but with the tilt, imagine being stuck like this for a couple weeks. Imagine doing that right now yourself. You wouldn't want to do that, let alone being head down in that tilt. Because what's that going to do? That's going to make the birth process a little bit tougher. And we might even have some things like torticollis come to play after that baby is born because there's just been such a shortness and such tightness in that area. So again, balancing out that area, which is actually what we call the Webster technique, is going to be crucial throughout your entire pregnancy. Now, Webster is something that we check on our moms from day one. Doesn't matter if you come in with in utero constraint or any issues with baby's positioning, we are always going to make sure to balance out that sacral area, make sure we take any tension off those round ligaments and allow everything to be flowing and properly functioning. At the same time, this is going to make your body so much more comfortable to be in. A ton is shifting. I get it. I'm going through it right now. Fortunately enough, I haven't experienced those lower back pains, those lower back issues, because I take care of my system just like I'm telling you to. I've been getting adjusted for, oh God, since I was, oh my God, it's been like 12, 13 years already. So already my body was in a different state, but even more so now, I continually get adjusted at least 2 to 3 times a week to make sure that my body's doing what it should. So give your body that opportunity, and guess what? Pregnancy doesn't have to be painful. Pregnancy doesn't have to be hard. There's parts of it that no matter what are just nature. It's just gonna happen. But the other parts of it are things that we can make so much smoother and so much easier for your body. So if you have any other questions, please let us know. We'd love to take care of you. We'd love to answer them for you. And of course, make sure that you have a phenomenal pregnancy, just like I'm going through.